I'm Dr. Bob McGrew from Cornerstone Family Medical Group in Modesto. This video segment on preventing chickenpox is one in a series of videos that provide information on commonly recommended immunizations. In order to discover what other videos we have available at Cornerstone, you can click on the videos link at our website, cornerstonefpmg.com. This video is intended to supply general information. For specific decisions about your health, you should always talk with your personal physician. Now, if you were born before 1980, you probably suffered from chickenpox when you were a young child, and you still may remember the itchy scabs that formed from this infection. In order for you to understand why chickenpox vaccine is a good idea, let me remind you about how bad this infection can be. In children, this infectious illness usually starts about 2 weeks after the germ is passed to a child from another infected child. Often it starts out with a rash, but sometimes there is fever, which can be up to 102 degrees Fahrenheit, and fatigue for a day or two before the rash starts. The rash is all over the body and often very itchy. It usually starts on the head, chest, and back, and then spreads over the rest of the body. The rash usually consists of 200 to 500 skin lesions. Now that's a lot. No wonder the kids are often pretty miserable. The initial skin lesion is a blister that looks like a dewdrop on a rose petal, which easily ruptures, leaving a scab. Blistering skin rashes used to be called pox, hence the name chickenpox. But don't ask me where the chicken part of the name came from. Other symptoms include tiredness, fever, headache, and sometimes a cough, which can be fairly severe. The disease lasts for 5 to 10 days, so the infected person will miss a lot of school or work. Also, it is caused by a highly infectious virus, so the infected person should not be at childcare, school, or work. As a longtime family doctor, I used to see many people, usually preschool kids, brought in with this itchy, miserable rash. Before chickenpox, also called varicella, vaccine became widespread, about 4 million people would get this disease each year. Also, about 10,000 people would be hospitalized with complications like bacterial skin infections or pneumonia, with 100 to 150 deaths in the US each year. Part of the reason for the hospitalizations and deaths is that chickenpox infection can cause a much more severe illness in certain groups of people, such as people over 50 years of age, pregnant women, and people whose immune systems don't work well, such as those on medications that lower their immune system activity in order to treat cancer, rheumatoid arthritis. As well, HIV-infected individuals do not handle this virus well. Thanks to the widespread use of the chickenpox vaccine, the number of infections and deaths each year has greatly diminished. It's been several years since I've seen anyone with chickenpox. Another advantage for the people who are prevented from ever having the chickenpox is they probably won't get the disease called shingles when they grow to be an older adult. Shingles, also known as herpes zoster, results from the chickenpox virus staying in a person's body after the initial chickenpox infection. The virus hides out in the nervous system until it comes out many years later, often in the 60s or 70s, as a painful blistering rash known as shingles. The current recommendations are for 2 doses of the chickenpox vaccine, which are about 98% effective in preventing chickenpox. The vaccine is given as a shot and contains live chickenpox virus, which is attenuated to cause a mild infection that does not cause you or your loved one to become ill. The vaccine induces your immune system to make protective antibodies so that if you or someone else gets exposed to this illness, somebody coughs in your face, for instance, the wild-type disease-causing virus which you're exposed to won't get you sick. Children under 6 years old should get 2 doses, usually at 12 to 15 months of age, then again at around 5 years old. Anyone who's over 6 years old and has never had chickenpox or the vaccine should also consider getting 2 doses of the vaccine. This is especially important for women of childbearing age, people who are around others with weakened immune systems, health and child care workers, teachers, and international travelers. Currently, there are 2 types of vaccine: the VariVax, which contains only the chickenpox vaccine, and the ProQuad, which combines the chickenpox vaccine with the measles, mumps, and rubella vaccines. When you or your child gets vaccinated, you protect yourself, your family, and the community. This is especially important for people who can't get vaccinated, such as pregnant women, or those with a weakened immune system, such as those undergoing cancer treatments. Side effects of the vaccine are not common. They include soreness, redness, or swelling at the injection site, occasionally mild fever, mild rash, or several small bumps develop around the injection site. Serious side effects from the vaccine are rare. They include jerking or staring spells that may be caused by fever, which occasionally is caused by the vaccine. Further information is on the vaccine information statement that is given to you before the vaccine is administered in the doctor's office. If you would like more information about the chickenpox vaccine or would like to look at that vaccine information statement, we recommend that you visit the CDC website at www.cdc.gov/chickenpox. The mission of the CDC, the Center for Disease Control in Atlanta, is to save lives and protect people. Its website has comprehensive, reliable information about vaccinations, and I derived some of the information for this talk from their website. You know, I get itchy just thinking about chickenpox, and it's hundreds of skin lesions. Please protect yourself and your loved ones from this by making sure that they get vaccinated.